At this year's 13th BGICC 2021, I will be talking about invasive lobular carcinoma and imaging of this very unusual variant of a breast cancer. As we all know, invasive lobular carcinoma is a very different pathological entity, and it grows in a very different fashion. It has a very linear and planar, um, growth, which makes imaging very unique. So in this talk, I will be talking about briefly some epidemiological aspects of invasive lobular carcinoma. We are going to look at the unique pathological features which actually drive how this cancer looks on imaging. And then we are going to look at some aspects of the radiological appearances of invasive lobular carcinoma on different modalities like mammography, ultrasound, obviously MRI, tomosynthesis, and also contrast enhanced mammography, and come up with some algorithm which we can use to diagnose this cancer. We will spend some time to discuss the role of breast MRI in the assessment and staging of invasive lobular carcinomas. Breast MRI staging is actually one of the key indications is actually invasive lobular carcinoma because of the unique way in which invasive lobular carcinoma grows. MRI is very, very beneficial in determining the exact extent, and studies have shown that the detection of MRI is far superior than any other breast imaging modality, particularly in the situation of invasive lobular carcinoma. We will be discussing management of invasive lobular carcinoma briefly, as we know that invasive lobular carcinoma tends to be bilateral. It is usually multifocal, and the extent of the disease is much larger than detected on imaging. And MRI, like I said, performs the best in correlation with the pathological extent of invasive lobular carcinoma. We also know that invasive lobular carcinoma has a lower frequency of axillary nodal spread than invasive ductal carcinoma of no special type. And so this is clearly beneficial in terms of distant metastasis and spread. Invasive lobular carcinoma also has unique type of distant metastasis that can go to serosal cavities, meninges, a bone, of course, to the regional lymph nodes, uterus, and many other locations. It's pretty unusual. So we will just touch upon the overall management of breast cancer as pertinent to the radiologist. At the end of the talk, I would also touch upon lobular neoplasia, which is like a high risk lesion and consists of atypical lobular hyperplasia and lobular carcinoma in situ. And the reason we're going to talk about is like some of these can herald or can warn us for the presence of underlying invasive lobular carcinoma, especially pleomorphic lobular carcinoma in situ is pretty much to be handled like invasive lobular carcinoma. And so we will go through it, and then we will discuss briefly how we are going to manage these high-risk lesions, the invasive, not the invasive lobular carcinoma, but the lobular neoplasia, and how we are going to use MRI in managing these high-risk lesions. So invasive lobular carcinoma and lobular neoplasia can present as calcifications, masses. They may be associated with other benign lesions such as fibroadenomas, rarely. And on the MRI, it shows a spectrum of appearances such as a mass, non-mass lesions. There may be extensive enhancement throughout the breast tissue in the form of dendritic appearance. And sometimes MRI can also be negative. So invasive lobular carcinoma is a very, very unusual cancer that can completely be missed on all imaging modalities, including breast MRI. And I hope that through this talk, we will get an overview of how this cancer looks on imaging, as well as how are we going to navigate some difficult situations when in the imaging of invasive lobular carcinoma. Thank you.